Question 1. To address the challenge of working with a client whose cultural background significantly differs from your own, and who expresses themselves through poetry that uses imagery and metaphors you find unfamiliar, what is the most ethically sound and professionally effective approach for a registered poetry therapist? Option A. Avoid discussing cultural differences to maintain a neutral therapeutic stance, focusing solely on the literal meaning of the words in the client's poems. Option B. Interpret the client's poetic imagery and metaphors based on your own cultural understanding, assuming that these symbols hold similar meanings for them. Option C. Proactively inquire about the client's cultural context and its potential influence on their poetic expression and interpretation, and be prepared to adapt your understanding and therapeutic approach accordingly. Option D. Assume that the universal nature of poetry allows for direct interpretation of the client's work, without needing to explore their specific cultural background. The correct answer is C. Proactively inquire about the client's cultural context and its potential influence on their poetic expression and interpretation, and be prepared to adapt your understanding and therapeutic approach accordingly. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a registered poetry therapist, PTR, to navigate the complexities of cultural differences in communication styles, emotional expression, and the interpretation of poetic language. Misunderstandings can arise from differing cultural norms regarding directness, emotional display, and the symbolic meanings attributed to certain imagery or themes within poetry. A failure to acknowledge and adapt to these differences can lead to misinterpretations of the client's experience, potentially causing distress, alienating the client, or hindering therapeutic progress. The PTR must exercise cultural humility and sensitivity to ensure the therapeutic relationship is built on trust and respect. Correct approach analysis. The correct approach involves actively seeking to understand the client's cultural background and its potential influence on their engagement with poetry therapy. This includes being open to learning about their specific cultural context, asking clarifying questions about their interpretations, and being willing to adapt therapeutic techniques to be culturally congruent. This aligns with the ethical principles of competence and respect for diversity, which are foundational to the practice of poetry therapy. It emphasizes a client-centered approach where the client's cultural identity is integrated into the therapeutic process, ensuring that the poetry used and the therapeutic interventions are meaningful and effective for that individual. This proactive and adaptive stance fosters a safe and inclusive therapeutic environment. Incorrect approach is analysis. Assuming that poetic expression and interpretation are universal and do not vary across cultures is a significant ethical and professional failure. This approach ignores the fundamental principle of cultural competence, leading to potential misinterpretations of the client's emotional state and therapeutic needs. It can result in the PTR imposing their own cultural lens onto the client's experience, which is a form of cultural bias and can be deeply invalidating. Another incorrect approach is to avoid discussing cultural differences altogether, believing that focusing solely on the poetry will transcend cultural barriers. While poetry can be a powerful bridge, ignoring the cultural context in which the client experiences and interprets the poetry can lead to superficial engagement and a lack of deep understanding. This avoidance can be perceived by the client as a lack of genuine interest in their full identity, potentially damaging the therapeutic alliance. Finally, imposing one's own cultural understanding of poetic symbolism onto the client's interpretation is a direct violation of ethical practice. This approach assumes a shared cultural framework that may not exist, leading to misdiagnosis or misjudgment of the client's therapeutic goals and progress. It demonstrates a lack of cultural humility and an over-reliance on the therapist's own cultural framework, which is not client-centered. Professional reasoning. Professionals should approach cross-cultural work with a framework of cultural humility, which involves a lifelong commitment to self-evaluation and self-critique. This means recognizing the limits of one's own cultural knowledge and being open to learning from the client. When working with clients from diverse backgrounds, professionals should 1. Engage in self-reflection to identify personal biases and assumptions. 2. Actively seek knowledge about the client's cultural background, but avoid stereotyping. 3. Prioritize open communication and ask clarifying questions about the client's experiences and interpretations. 4. Be flexible and adapt therapeutic interventions to be culturally sensitive and relevant. 5. Consult with supervisors or colleagues when encountering complex cultural issues. Question 2. The monitoring system demonstrates a client's engagement with a poem that evokes a somber and melancholic mood. The client expresses feeling deeply saddened by the poem's imagery. As a registered poetry therapist, PTR, how should you best respond to this interaction, considering the interplay between the poem's inherent mood and the client's emotional response? Option A. Focus solely on a literary analysis of the poem's structure and meter, explaining how these elements create the somber mood, without addressing the client's emotional reaction. Option B. Directly interpret the poem's somber mood as a direct reflection of the client's current psychological state, advising them to focus on more uplifting poetry. Option C. Suggest that the client's interpretation of sadness is an overreaction to the poem's objective tone, and guide them towards a more detached, analytical understanding of the text. Option D. Acknowledge the client's sadness and explore how the poem's somber mood resonates with their personal experiences, while also gently discussing the specific poetic devices that contribute to this mood. Correct answer is D. Acknowledge the client's sadness and explore how the poem's somber mood resonates with their personal experiences, while also gently discussing the specific poetic devices that contribute to this mood. Explanation. The monitoring system demonstrates a need for careful consideration of how a registered poetry therapist, PTR, interprets and responds to the emotional landscape presented in a client's poetry. The challenge lies in distinguishing between the inherent tone and mood of the poem itself, and the client's personal emotional response or intention behind it. A PTR must be attuned to both, recognizing that the poem's effective qualities can be a conduit for the client's internal experience, but also that the client's lived experience may color their perception of the poem's tone and mood. This requires a nuanced understanding of poetic devices and their psychological impact, balanced with a deep respect for the client's subjective reality. The correct approach involves a comparative analysis that acknowledges the poem's objective tonal and mood elements, while also exploring the client's subjective interpretation and emotional connection to those elements. This aligns with the ethical guidelines for PTRs, which emphasize client-centered practice, active listening, and the use of poetry as a tool for self-exploration and healing. By validating the client's feelings and experiences in relation to the poem's mood, the PTR fosters a safe and therapeutic environment. This approach respects the client agency and promotes a collaborative therapeutic process, where the poem serves as a shared point of exploration. An incorrect approach would be to solely focus on the objective literary analysis of the poem's tone and mood, disregarding the client's personal emotional response. This fails to recognize the therapeutic purpose of poetry therapy, which is to engage with the client's inner world. Such an approach could invalidate the client's feelings, leading to a breakdown in trust and hindering therapeutic progress. Another incorrect approach would be to impose a personal interpretation of the poem's tone and mood onto the client, without allowing for their own subjective experience. This violates the principle of client autonomy and can be perceived as judgmental or dismissive. A third incorrect approach might be to overemphasize the potential for negative interpretations of tone and mood, leading to an unnecessarily alarming or pathologizing response, without sufficient grounding in the client's expressed experience. This can create undue anxiety and detract from the potential for growth and insight. Professionals should approach such situations by first attending to the client's expressed feelings and associations with the poem. Then, they should gently introduce an exploration of the poem's inherent tonal and mood qualities, using open-ended questions to invite the client's perspective. The goal is to create a dialogue where both the poem's artistic elements and the client's personal experience are given equal weight, fostering a deeper understanding of the client's emotional landscape. Question 3. Governance review demonstrates that a registered poetry therapist, PTR, is working with a client experiencing significant emotional distress and expressing a desire to explore their feelings openly. The PTR is considering which poetic form to introduce. Which of the following approaches best aligns with ethical and effective poetry therapy practice in this scenario? Option A. Select a sonnet, as its structured form can provide a sense of order and control, which might be helpful for a client feeling overwhelmed. Option B. Introduce free verse, as its flexibility allows for uninhibited emotional expression without the constraints of strict meter or rhyme, which may be beneficial for a client in acute distress. Option C. Recommend a villanelle, as its repetitive structure can help a client process complex emotions through cyclical exploration. Option D. Suggest a haiku, as its brevity and focus on imagery can offer a simple yet profound way to capture fleeting feelings. The correct answer is B. Introduce free verse, as its flexibility allows for uninhibited emotional expression without the constraints of strict meter or rhyme, which may be beneficial for a client in acute distress. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a registered poetry therapist, PTR, to balance the therapeutic goals of a client with the inherent structural and expressive qualities of different poetic forms. The challenge lies in selecting a form that not only resonates with the client's current emotional state and therapeutic objectives, but also aligns with the established ethical and professional guidelines for poetry therapy practice. Misjudging this can lead to ineffective therapy or even a breach of professional conduct. Correct approach analysis. The correct approach represents best professional practice because it prioritizes the client's individual needs and therapeutic journey. By considering the client's emotional state and the potential impact of a specific poetic form on their expression and processing, the PTR acts in accordance with the core ethical principles of client-centered care and beneficence. The selection of free verse, in this instance, is justified by its inherent flexibility, allowing for uninhibited emotional expression without the constraints of meter or rhyme, which could be beneficial for a client experiencing significant emotional distress. This aligns with the PTR's responsibility to adapt therapeutic modalities to the client's unique situation, ensuring the therapy is both accessible and effective. Incorrect approaches analysis. One incorrect approach involves rigidly adhering to a complex form like a sonnet for a client experiencing acute emotional turmoil. This fails to acknowledge the potential for the form's strictures to inhibit genuine expression or create undue pressure, potentially hindering therapeutic progress and contravening the principle of doing no harm. It prioritizes poetic structure over client well-being. Another incorrect approach is to dismiss all structured poetic forms outright, assuming they are inherently unsuitable for therapeutic work. This overlooks the potential benefits that structured forms can offer in providing a container for intense emotions, fostering discipline in expression, or facilitating a sense of order for a client. It represents a failure to explore the full range of therapeutic tools available and a potential limitation of the PTR's professional repertoire, thereby not maximizing the client's therapeutic potential. A third incorrect approach is to select a poetic form based solely on the PTR's personal preference or familiarity, without adequate consideration of the client's specific needs or the therapeutic context. This is a significant ethical failure, as it places the therapist's convenience or aesthetic predilections above the client's therapeutic goals and well-being, violating the fundamental duty of care. Professional reasoning. Professionals should approach this situation by first conducting a thorough assessment of the client's current emotional state, their history, and their therapeutic goals. This assessment should inform the selection of poetic forms. The PTR should then consider the characteristics of various forms, their structure, rhythm, and typical expressive qualities, and how these might interact with the client's presentation. The decision-making process should be collaborative, involving the client in understanding the rationale behind suggested forms and allowing for their input. The ultimate choice should be the one that best serves the client's therapeutic needs, adhering to ethical principles of beneficence, non-maleficence, and client autonomy. Question 4. Benchmark analysis indicates that a registered poetry therapist, PTR, is working with a client who has presented a poem that utilizes a consistent abab rhyme scheme and iambic tetrameter. The client expresses feeling stuck and trapped in their current life circumstances. Which of the following approaches to analyzing the poem's structure would best serve the client's therapeutic goals? Option A. Identifying and listing all instances of iambic tetrameter and the abab rhyme scheme, and then discussing the historical context of these poetic forms in literature. Option B. Focusing solely on the literal meaning of the words in the poem, disregarding any structural elements as irrelevant to the client's emotional experience. Option C. Exploring how the regular, predictable rhyme scheme and meter might mirror or contrast with the client's feeling of being trapped, and how the poem's containment within its structure could offer a metaphor for finding order or release within perceived limitations. Option D. Analyzing the poem's structure by comparing its meter and rhyme scheme to a more complex free verse poem, highlighting the perceived simplicity of the client's chosen form. The correct answer is C. exploring how the regular, predictable rhyme scheme and meter might mirror or contrast with the client's feeling of being trapped, and how the poem's containment within its structure could offer a metaphor for finding order or release within perceived limitations. Explanation. This scenario presents a professional challenge for a registered poetry therapist, PTR, in understanding how to apply structural analysis of poetry within a therapeutic context. The challenge lies in balancing the academic rigor of poetic analysis with the client's subjective experience and therapeutic goals, ensuring that the analysis serves the client's well-being rather than becoming an intellectual exercise detached from their needs. Careful judgment is required to select analytical techniques that are both relevant to the poem's form and accessible to the client, fostering insight and emotional processing. The correct approach represents best professional practice because it prioritizes the client's therapeutic journey. By focusing on how poetic structure, e.g., stanza breaks, line length, rhyme scheme, meter, influences the emotional tone, thematic development, and overall impact of the poem, the PTR can guide the client to deeper self-understanding. This aligns with the ethical guidelines for PTRs, which emphasize client-centered care and the responsible application of therapeutic tools. The analysis of structure, when used therapeutically, helps to illuminate the underlying patterns and dynamics within the client's own narrative or emotional landscape, as reflected in the poem. An incorrect approach that solely focuses on identifying and labeling poetic devices without connecting them to the client's experience or therapeutic goals fails to meet professional standards. This could be seen as a failure to adhere to the principle of beneficence, as it does not actively contribute to the client's healing or growth. Another incorrect approach might involve imposing an overly academic or complex structural analysis that overwhelms or alienates the client, demonstrating a lack of sensitivity to their current capacity and needs, which is a breach of the ethical duty of care. A third incorrect approach could be to ignore structural elements entirely, focusing only on literal content, thereby missing opportunities to explore deeper meanings and emotional resonances that are often conveyed through the poem's form. This would be a failure to fully utilize the therapeutic potential of poetry. The professional decision-making process for similar situations should involve a continuous assessment of the client's engagement and response. The PTR should first consider the client's stated goals and current emotional state. Then, they should select analytical techniques that are appropriate for the specific poem and the client's level of understanding. The PTR must remain flexible, adapting their approach based on the client's feedback and insights, ensuring that the analysis remains a collaborative and supportive process, always in service of the client's therapeutic objectives. Question 5. Consider a scenario where a registered poetry therapist, PTR, is working with a client who has experienced significant trauma related to their cultural heritage. The client expresses a desire to explore their experiences through poetry, but is also hesitant due to past negative associations with their cultural narratives. Which approach best aligns with the ethical and professional standards for a PTR in this situation? Option A. Conduct a thorough cultural assessment and collaboratively select poetry that resonates with the client's cultural background, while proceeding with caution and offering choices in how to engage with the material, prioritizing the client's sense of safety and control. Option B. Focus on abstract or metaphorical poetry that avoids direct references to cultural identity or trauma, aiming to create a neutral therapeutic space. Option C. Immediately introduce well-known poems that address themes of resilience and overcoming adversity, assuming these universal themes will be helpful regardless of the client's specific cultural context. Option D. Encourage the client to write poetry that directly confronts and details their traumatic experiences without any prior exploration of their cultural context or emotional readiness. The correct answer is A. Conduct a thorough cultural assessment and collaboratively select poetry that resonates with the client's cultural background, while proceeding with caution and offering choices in how to engage with the material, prioritizing the client's sense of safety and control. Explanation. This scenario presents a professional challenge because it requires a poetry therapist, PTR, to navigate the ethical and practical considerations of using poetry therapy with a client who has a history of trauma, specifically in relation to their cultural background. The core of the challenge lies in ensuring that the therapeutic approach is not only effective, but also culturally sensitive and avoids re-traumatization. Careful judgment is required to select an intervention that honors the client's lived experience and cultural context while adhering to professional standards. The correct approach represents best professional practice because it prioritizes a client-centered, culturally informed, and trauma-informed methodology. This involves a thorough assessment of the client's specific needs, cultural background, and potential sensitivities before introducing any poetry therapy interventions. The use of culturally relevant poetry and a gradual, collaborative approach to exploration ensures that the client feels safe, respected, and empowered. This aligns with the ethical guidelines of the Registered Poetry Therapist (PTR) credential, which emphasizes client well-being, cultural competence, and the avoidance of harm. An incorrect approach that involves immediately introducing poetry that directly mirrors the client's traumatic experiences without prior assessment or cultural consideration would be a significant regulatory and ethical failure. This could lead to re-traumatization, a breach of the duty of care, and a violation of the principle of do no harm. Another incorrect approach, such as focusing solely on generic, universally acclaimed poetry without acknowledging or integrating the client's cultural identity, fails to recognize the importance of cultural context in healing and could alienate the client, undermining the therapeutic alliance. A third incorrect approach, which might involve imposing a specific poetic form or interpretation on the client, disregards the client's autonomy and the collaborative nature of poetry therapy, potentially leading to feelings of invalidation and a breakdown in trust. Professionals should employ a decision-making framework that begins with a comprehensive client assessment, including cultural background and trauma history. This is followed by a collaborative goal-setting process, where the client's preferences and comfort levels are paramount. Interventions should be selected and adapted based on this assessment, with a strong emphasis on cultural relevance and safety. Ongoing monitoring of the client's response and flexibility in adjusting the therapeutic approach are crucial. This systematic and client-focused process ensures adherence to ethical principles and regulatory requirements for registered poetry therapists. Question 6. The investigation demonstrates that a registered poetry therapist, PTR, is working with a client who reports significant positive emotional release and a sense of profound personal insight from engaging with a specific poem. Yet the client's interpretation and the way they connect with the poem's imagery do not align with the primary theoretical framework the PTR typically utilizes for such interventions. The PTR is considering how to proceed. Which of the following represents the most therapeutically sound and ethically responsible approach? Option A. Explore the client's unique interpretation and the personal meaning they derive from the poem, seeking to understand the underlying psychological processes that may be contributing to their reported benefits, while remaining open to how this experience might inform or even expand upon existing theoretical understandings of poetry therapy. Option B. Acknowledge the client's subjective experience, but express concern that their unconventional engagement might limit the depth of therapeutic impact, suggesting a shift to a different therapeutic modality. Option C. Focus solely on the client's reported positive feelings, without delving into the specific interpretation or theoretical underpinnings, assuming that the subjective experience is sufficient evidence of therapeutic success. Option D. Gently guide the client towards a more conventional interpretation of the poem that aligns with the established theoretical framework, explaining that this is the generally accepted way to derive therapeutic benefit from such texts. Correct answer is A. Explore the client's unique interpretation and the personal meaning they derive from the poem, seeking to understand the underlying psychological processes that may be contributing to their reported benefits, while remaining open to how this experience might inform or even expand upon existing theoretical understandings of poetry therapy. Explanation. This scenario presents a professional challenge because it requires the registered poetry therapist, PTR, to navigate the ethical and theoretical underpinnings of their practice when faced with a client whose engagement with poetry therapy deviates from typical expectations. The PTR must balance the client's subjective experience and perceived benefit with established theoretical frameworks, and the ethical imperative to provide effective and appropriate therapeutic interventions. Careful judgment is required to avoid imposing a rigid theoretical framework that might invalidate the client's experience or, conversely, to abandon theoretical grounding entirely, risking a lack of efficacy and professional accountability. The correct approach represents best professional practice because it acknowledges the client's reported positive outcomes while grounding the therapeutic process in established theoretical foundations of poetry therapy. This approach aligns with the ethical guidelines for PTRs, which emphasize client-centered care, evidence-informed practice, and the importance of a strong theoretical basis for interventions. By exploring the client's unique interpretation and connection to the poetry, the PTR is engaging in a process of meaning-making that is central to many theoretical models of poetry therapy, such as those emphasizing catharsis, insight, or self-discovery through creative expression. This approach respects the client's agency and subjective experience while maintaining professional rigor and a commitment to therapeutic efficacy. An incorrect approach that focuses solely on the client's subjective report without considering the underlying theoretical mechanisms of change risks a superficial engagement with the therapeutic process. This could lead to a lack of depth in the intervention and potentially fail to address underlying issues. Ethically, it might be considered a failure to provide a well-grounded therapeutic service if the interventions are not informed by recognized theoretical principles. Another incorrect approach that dismisses the client's experience because it doesn't fit a preconceived theoretical model is ethically problematic. It prioritizes the therapist's theoretical adherence over the client's lived experience and reported benefits, potentially leading to alienation and a breakdown of the therapeutic alliance. This approach fails to acknowledge the flexibility and adaptability required in therapeutic practice and may violate the ethical principle of beneficence by not fully exploring what is beneficial for the client. A further incorrect approach that attempts to force the client's experience into a single, rigid theoretical framework without exploring the nuances of their engagement is also professionally unsound. This can lead to misinterpretation of the client's progress and may stifle their creative and emotional exploration. It demonstrates a lack of understanding of the diverse ways in which poetry can be therapeutic, and a failure to adapt theoretical principles to the individual client's needs. A professional decision-making process for similar situations should involve a continuous cycle of assessment, intervention, and evaluation, all informed by theoretical knowledge and ethical principles. Professionals should begin by actively listening to and validating the client's experience. They should then consider how this experience aligns with or diverges from established theoretical frameworks, seeking to understand the underlying mechanisms of change. Interventions should be tailored to the individual client, drawing upon theoretical principles while remaining flexible and responsive. Finally, ongoing evaluation of the client's progress and the effectiveness of the interventions is crucial, with adjustments made as needed, always prioritizing the client's well-being and therapeutic goals within an ethical and theoretically informed practice. Question 7. Upon reviewing a client's recent poetry, which powerfully expresses themes of overcoming adversity, the client expresses a strong desire to submit these poems to a local literary journal for publication. As a registered poetry therapist, PTR, what is the most ethically sound and therapeutically appropriate course of action? Option A. Offer to submit the poems on behalf of the client to the journal without further discussion, assuming their desire to publish indicates a readiness for public engagement. Option B. Advise the client against publication, explaining that the therapeutic space is not intended for public exposure of personal work and that it could jeopardize their progress. Option C. Engage in a detailed discussion with the client about their motivations for publication, explore potential impacts on their therapeutic process and privacy, and collaboratively assess their readiness and the implications of public disclosure before proceeding. Option D. Immediately agree to help the client submit the poems to the journal, as supporting their creative endeavors is a primary goal of poetry therapy. The correct answer is C. Engage in a detailed discussion with the client about their motivations for publication, explore potential impacts on their therapeutic process and privacy, and collaboratively assess their readiness and the implications of public disclosure before proceeding. Explanation. This scenario presents a common challenge for registered poetry therapists, PTR, in navigating the ethical and professional boundaries of their practice when a client expresses a desire to share their poetry publicly. The core challenge lies in balancing the client's autonomy and creative expression with the PTR's responsibility to ensure the therapeutic process remains safe, confidential, and focused on the client's well-being. The PTR must consider the potential impact of public disclosure on the client's therapeutic journey, their privacy, and the integrity of the therapeutic relationship. The correct approach prioritizes the client's informed consent and therapeutic goals. It involves a thorough discussion with the client about the implications of public sharing, exploring their motivations, potential risks and benefits, and ensuring they understand the impact on confidentiality and their ongoing therapeutic work. This aligns with the ethical guidelines for PTRs, which emphasize client autonomy, informed consent, and the paramount importance of the client's welfare. By facilitating a collaborative decision-making process, the PTR upholds the client's right to self-determination while ensuring the therapeutic relationship remains a safe space for exploration. An incorrect approach would be to immediately agree to facilitate the public sharing without a comprehensive discussion. This fails to adequately assess the client's readiness or potential vulnerabilities, potentially leading to unintended negative consequences for the client's mental health and therapeutic progress. It also risks breaching the implicit or explicit confidentiality agreements inherent in the therapeutic relationship. Another incorrect approach would be to unilaterally refuse the client's request, thereby undermining their autonomy and potentially damaging the therapeutic alliance. This paternalistic stance disregards the client's agency and their right to make decisions about their own creative output, even within a therapeutic context. A further incorrect approach might involve sharing the client's poetry without explicit, informed consent, which is a direct violation of ethical and potentially legal privacy standards. The professional decision-making process for similar situations should involve a structured approach. 1. Identify the core ethical dilemma. Recognize the tension between client autonomy, therapeutic goals, and professional responsibilities. 2. Gather information. Understand the client's motivations, the nature of the poetry, and their understanding of public sharing. 3. Consult ethical guidelines. Refer to the specific ethical codes and standards for registered poetry therapists. 4. Engage in open dialogue with the client. Facilitate a collaborative discussion about risks, benefits, and alternatives. 5. Prioritize client well-being. Ensure any decision made serves the client's best therapeutic interests. 6. Document the process. Record the discussion, decisions made, and the rationale behind them. Question 8. The performance metrics show a consistent pattern of a client requesting to focus exclusively on writing poems about their perceived injustices, actively avoiding any exploration of their own role or feelings related to these situations, despite the PTR's attempts to gently broaden the scope of the sessions. What is the most ethically sound and therapeutically effective approach for the registered poetry therapist to take in this situation? Option A. Engage in a direct conversation with the client about the observed pattern, exploring their resistance to examining their own feelings and role, and collaboratively redefining therapeutic goals to include a balanced approach to exploring both external injustices and internal responses. Option B. Continue to facilitate the client's writing about injustices as requested, assuming this is their primary therapeutic need, and document the sessions as per the client's expressed wishes. Option C. Gently redirect the client towards writing about positive experiences or coping mechanisms, subtly shifting the focus away from the perceived injustices without directly addressing the client's resistance. Option D. Inform the client that their current approach is not conducive to therapeutic progress and suggest they seek therapy elsewhere if they are unwilling to explore their internal experiences. The correct answer is A. Engage in a direct conversation with the client about the observed pattern, exploring their resistance to examining their own feelings and role, and collaboratively redefining therapeutic goals to include a balanced approach to exploring both external injustices and internal responses. Explanation. This scenario presents a professional challenge because it requires balancing the client's expressed desire for a specific therapeutic outcome with the registered poetry therapist's PTR ethical obligation to facilitate a process that is safe, appropriate, and aligned with the principles of poetry therapy. The PTR must navigate the potential for the client's request to be either a genuine therapeutic goal or a manifestation of resistance, avoidance, or a misunderstanding of the therapeutic process. Careful judgment is required to ensure the client's well-being and the integrity of the therapeutic relationship. The correct approach represents best professional practice because it prioritizes client autonomy while maintaining professional boundaries and adhering to the ethical guidelines of the registered poetry therapist PTR credentialing body. This approach involves open communication, exploration of the client's underlying needs and motivations, and collaborative goal setting. It acknowledges the client's agency in expressing their desires, but frames them within the context of the therapeutic process, ensuring that the poetry therapy is not being used in a way that could be detrimental or counterproductive. This aligns with ethical principles of informed consent, beneficence, and non-maleficence, as the PTR is actively working to understand and address the client's needs in a therapeutic manner. An incorrect approach that focuses solely on fulfilling the client's stated request without further exploration fails to uphold the PTR's ethical responsibility to assess the appropriateness and potential impact of the request. This could lead to a superficial engagement with the therapeutic material, potentially reinforcing maladaptive patterns or avoiding deeper issues that require attention. It may also violate the principle of beneficence by not ensuring the therapy is maximally beneficial. Another incorrect approach that dismisses the client's request outright without adequate exploration can be perceived as paternalistic and may damage the therapeutic alliance. This can lead to client disengagement and a failure to address the underlying reasons for the request, potentially hindering therapeutic progress. It may also be seen as a failure to respect the client's expressed needs, even if those needs require careful therapeutic navigation. A further incorrect approach that involves imposing the PTR's own agenda or preferred therapeutic techniques without considering the client's input disregards the collaborative nature of poetry therapy and the importance of client-centered practice. This can undermine trust and create a power imbalance that is not conducive to effective therapy. The professional decision-making process for similar situations involves a cyclical approach: active listening to the client's expressed needs and desires, empathetic exploration of the underlying motivations and potential therapeutic benefits or risks of the request, collaborative negotiation of therapeutic goals and methods, an ongoing assessment of the client's progress and the effectiveness of the chosen interventions, all within the framework of established ethical guidelines for registered poetry therapists. Question 9. Examination of the data shows that a registered poetry therapist, PTR, is discussing their practice with a potential client who has previously engaged in other forms of therapy. The client asks how poetry therapy differs from their past experiences. Which of the following statements best articulates the unique nature of poetry therapy within its regulatory framework? Option A. Poetry therapy is a distinct therapeutic approach that uses the engagement with and response to poetry and poetic language to achieve therapeutic goals, fostering emotional processing, insight, and personal growth within a guided therapeutic relationship. Option B. Poetry therapy is primarily a method of teaching clients how to write poetry for self-expression, focusing on literary technique and creative output. Option C. Poetry therapy is a form of bibliotherapy, where clients are given poems to read independently to find their own solutions to problems. Option D. Poetry therapy is essentially the same as general talk therapy, where the client discusses their feelings and experiences, with the added element of occasionally referencing poems. The correct answer is A. Poetry therapy is a distinct therapeutic approach that uses the engagement with and response to poetry and poetic language to achieve therapeutic goals, fostering emotional processing, insight, and personal growth within a guided therapeutic relationship. Explanation: this scenario presents a professional challenge because a registered poetry therapist, PTR, must accurately differentiate their practice from other therapeutic modalities to ensure ethical and effective client care, and to maintain professional integrity within the scope of their certification. Misrepresenting or conflating poetry therapy with other approaches can lead to client confusion, unmet therapeutic needs, and potential breaches of professional standards. Careful judgment is required to articulate the unique contributions of poetry therapy. The correct approach represents best professional practice because it clearly defines poetry therapy as a distinct modality that utilizes the creative process of engaging with and responding to poetry to achieve therapeutic goals. This aligns with the established principles and ethical guidelines for registered poetry therapists, emphasizing the specific use of poetic language, metaphor, and narrative for emotional processing, insight generation, and personal growth. It respects the unique skill set and theoretical underpinnings of poetry therapy, ensuring clients receive services appropriate to their needs, and the therapist operates within their defined professional scope. An incorrect approach that conflates poetry therapy with general talk therapy fails to acknowledge the specific, often nonverbal or metaphor-driven, engagement with text that is central to poetry therapy. This is an ethical failure, as it misrepresents the service offered, potentially leading clients to expect a different therapeutic experience than what is provided. It also devalues the specialized training and techniques of a PTR. Another incorrect approach that equates poetry therapy with bibliotherapy without acknowledging the active therapeutic relationship and guided creative response inherent in poetry therapy is also an ethical failure. Bibliotherapy typically involves recommending books for self-help, whereas poetry therapy is an interactive process facilitated by a trained therapist. This misrepresentation can lead to a misunderstanding of the therapist's role and the depth of the therapeutic intervention. A third incorrect approach that suggests poetry therapy is simply a form of creative writing instruction is also ethically problematic. While creative writing may be a component, the primary focus in poetry therapy is therapeutic outcomes, not the development of writing skills for their own sake. This misunderstanding can lead to inappropriate client expectations and a failure to address underlying psychological issues. The professional decision-making process for similar situations involves a commitment to ongoing professional development, a thorough understanding of one's own therapeutic modality, and clear, honest communication with clients about the nature of the services offered. Professionals should regularly review their practice against the ethical codes and standards of their certifying body, such as those for registered poetry therapists, and be prepared to articulate the distinct value and methodology of their specialization. When faced with ambiguity, seeking supervision or consultation with experienced peers is a crucial step in ensuring ethical and effective practice. Question 10. Governance review demonstrates that a registered poetry therapist, PTR, is working with a client experiencing low self-esteem. The PTR aims to utilize poetry to enhance the client's self-worth. Considering the PTR's professional responsibilities and ethical guidelines, which of the following approaches best facilitates the client's self-esteem enhancement through poetry? Option A. Dictating specific themes and imagery for the client's poems, ensuring they align with the therapist's perception of what constitutes high self-esteem. Option B. Assigning the client a series of pre-written poems that focus on themes of confidence and resilience for the client to memorize and recite regularly. Option C. Encouraging the client to write poems solely about their perceived failures and weaknesses, with the therapist offering interpretations aimed at reframing these as learning opportunities. Option D. Collaboratively identifying the client's strengths and values, then co-creating poetic forms that reflect these positive attributes, with the PTR guiding the process through therapeutic inquiry and poetic techniques. The correct answer is D. Collaboratively identifying the client's strengths and values, then co-creating poetic forms that reflect these positive attributes, with the PTR guiding the process through therapeutic inquiry and poetic techniques. Explanation. This scenario presents a professional challenge because a registered poetry therapist, PTR, must navigate the delicate balance between facilitating a client's self-esteem enhancement through poetry and ensuring that the therapeutic process remains within ethical and professional boundaries, adhering strictly to the guidelines set forth by the relevant professional body for PTRs. The core of the challenge lies in selecting the most appropriate therapeutic approach that leverages poetry's power for self-esteem while respecting client autonomy and avoiding therapeutic overreach. The correct approach represents best professional practice because it prioritizes a client-centered, collaborative method. This involves actively engaging the client in identifying their strengths and values, and then co-creating poetic forms that reflect these positive attributes. This aligns with the ethical imperative for PTRs to empower clients and foster their intrinsic capacity for growth. The process is guided by the PTR's expertise in poetry and therapeutic techniques, ensuring that the exploration of self-esteem is conducted in a safe, supportive, and developmentally appropriate manner, consistent with the PTR's scope of practice and commitment to client well-being. An incorrect approach that focuses solely on assigning pre-written poems for memorization or recitation would fail to foster genuine self-esteem. This is because it bypasses the client's active participation and internal processing, potentially leading to a superficial sense of worth rather than a deeply integrated one. Ethically, this approach could be seen as disempowering, treating the client as a passive recipient rather than an active agent in their own therapeutic journey. It also risks misinterpreting the client's internal experience and imposing external narratives, which is contrary to the principles of client-centered therapy. Another incorrect approach that involves the therapist dictating specific themes and imagery for the client's poems, even with the intention of boosting self-esteem, would also be professionally unacceptable. This represents a failure to respect client autonomy and the unique voice of the individual. Such an approach could inadvertently invalidate the client's lived experiences and feelings, leading to a sense of being misunderstood or controlled. This directly contravenes the ethical guidelines that emphasize the importance of the client's narrative and their right to self-determination in the therapeutic process. A professional decision-making process for similar situations should involve a thorough assessment of the client's needs and goals, followed by a collaborative exploration of how poetry can best serve those objectives. The PTR must continuously evaluate the effectiveness of their interventions, remaining attuned to the client's responses and adjusting their approach as needed. This requires a deep understanding of both poetic principles and therapeutic modalities, coupled with a strong ethical compass that prioritizes client welfare, autonomy, and the cultivation of authentic self-esteem. Question 11. Process analysis reveals that a poetry therapy group participant is consistently withdrawn and hesitant to engage with writing prompts, often stating they don't know what to write or "it's not for me." The registered poetry therapist, PTR, needs to encourage participation without alienating the individual or violating ethical guidelines. Which of the following approaches best facilitates voluntary engagement in this scenario? Option A. Gently offer a variety of accessible, low-stakes prompts, acknowledge their feelings of hesitation, and model a brief personal response to a prompt to demonstrate vulnerability and normalize the process. Option B. Immediately present a deeply personal and emotionally charged writing prompt, assuming that a strong stimulus will break through their reticence. Option C. Directly ask the participant why they are so resistant to writing, suggesting that their lack of participation is hindering the group's progress. Option D. Ignore the participants' hesitations and proceed with the planned group activity, assuming they will eventually join in when they are ready. Correct answer is A. Gently offer a variety of accessible, low-stakes prompts, acknowledge their feelings of hesitation, and model a brief, personal response to a prompt to demonstrate vulnerability and normalize the process. Explanation. Scenario analysis. This scenario presents a common challenge in poetry therapy, engaging individuals who are hesitant or resistant to participate in creative expression. The professional must balance the therapeutic goals of fostering self-expression and connection with the individual's autonomy and comfort level. Forcing participation or imposing a specific style can be counterproductive and undermine the therapeutic alliance. Careful judgment is required to create a safe and inviting environment that encourages voluntary engagement. Correct approach analysis. The correct approach involves creating a low-pressure, invitational atmosphere that respects the individual's pace and preferences, offering a variety of accessible prompts, acknowledging and validating their feelings of hesitation, and modeling gentle engagement are key. This aligns with the ethical principles of poetry therapy, which emphasize client-centered care, respect for autonomy, and the creation of a safe space for exploration. The registered poetry therapist, PTR, is guided by the ethical standards of the National Association for Drama Therapy, NAT, and the Poetry Therapy Institute, TI, which prioritize client well-being and non-coercive therapeutic practices. This approach fosters trust and empowers the client to engage when they feel ready, thereby enhancing the therapeutic effectiveness. Incorrect approaches analysis. One incorrect approach involves directly confronting the individual's reluctance with direct questioning about their reasons for not participating. This can feel intrusive and judgmental, potentially increasing their resistance and damaging the therapeutic relationship. Ethically, this violates the principle of respecting client boundaries and can be perceived as pressuring, which is contrary to best practices in client-led therapy. Another incorrect approach is to immediately introduce complex or highly personal writing prompts without first establishing rapport or assessing the individual's comfort level. This can overwhelm the participant and reinforce their feelings of inadequacy or apprehension. From a regulatory and ethical standpoint, this demonstrates a lack of sensitivity to the client's current state and a failure to adapt therapeutic techniques to individual needs, potentially leading to a negative therapeutic experience. A third incorrect approach is to dismiss the individual's hesitation and proceed with the planned activity as if their reluctance is not significant. This invalidates their feelings and can lead to feelings of being unheard or misunderstood. Ethically, this is a failure to acknowledge and respond to the client's emotional state, which is fundamental to building a therapeutic alliance and ensuring a safe therapeutic environment. Professional reasoning. Professionals should employ a decision-making framework that prioritizes client-centeredness, ethical adherence, and adaptability. This involves active listening, empathetic attunement to the client's verbal and nonverbal cues, and a flexible approach to therapeutic interventions. When faced with resistance, the professional should first seek to understand the underlying reasons without judgment, offer choices, and gradually introduce activities that build confidence and trust. Adherence to the ethical codes of professional organizations like NAT and PTI is paramount in guiding these decisions, ensuring that all interventions are in the best interest of the client and uphold the integrity of the profession. Question 12. Analysis of the historical trajectory and foundational definitions of poetry therapy is essential for a registered poetry therapist, PTR, to establish and maintain professional credibility. Which of the following best encapsulates the historical development and core definition of poetry therapy as a distinct therapeutic modality? Option A. Poetry therapy emerged from the intersection of literary criticism and clinical psychology, evolving from the understanding that engaging with poetry could facilitate emotional processing, insight, and healing, and is defined by the intentional use of poetry and other creative writing forms in a therapeutic relationship to address psychological and emotional needs. Option B. Poetry therapy is primarily a modern invention stemming from the self-help movement of the late 20th century, focusing solely on the positive affirmations found in inspirational verse to boost self-esteem. Option C. Poetry therapy is a form of bibliotherapy that involves recommending specific poems to clients for independent reading, with no emphasis on a therapeutic relationship or structured facilitation. Option D. Poetry therapy is an ancient practice rooted in shamanistic rituals where spoken word was used to commune with spirits, and its modern application is a direct continuation of these spiritual traditions. The correct answer is A. Poetry therapy emerged from the intersection of literary criticism and clinical psychology, evolving from the understanding that engaging with poetry could facilitate emotional processing, insight, and healing, and is defined by the intentional use of poetry and other creative writing forms in a therapeutic relationship to address psychological and emotional needs. Explanation. This scenario presents a professional challenge in accurately defining and contextualizing poetry therapy within its historical and theoretical foundations, which is crucial for maintaining professional integrity and providing evidence-based practice. A registered poetry therapist, PTR, must demonstrate a thorough understanding of the discipline's evolution to effectively apply its principles and communicate its value to clients, colleagues, and the wider community. The correct approach represents best professional practice because it accurately reflects the historical development of poetry therapy, acknowledging its roots in literary analysis and its evolution into a therapeutic modality. This understanding is foundational for a PTR, as it informs the theoretical underpinnings of their practice and aligns with the ethical imperative to practice within one's scope of competence, which includes a deep understanding of the field's history and definition. Adherence to the established definitions and historical trajectory ensures that the practice remains grounded and distinguishable from other forms of expressive arts or general counseling. Incorrect approaches fail to meet professional standards due to misrepresentation of the field's origins and scope. One incorrect approach might overemphasize a singular, narrow definition that neglects the broader historical influences and the interdisciplinary nature of poetry therapy. This can lead to a misunderstanding of its therapeutic efficacy and its place within the broader mental health landscape. Another incorrect approach might conflate poetry therapy with simple bibliotherapy or creative writing exercises without acknowledging the specific training, theoretical frameworks, and ethical considerations that differentiate it as a distinct therapeutic modality. This failure to differentiate can lead to misapplication of techniques, inadequate client care, and a dilution of the professional identity of a PTR. A further incorrect approach might present a history that is anachronistic or misattributes key developments, undermining the credibility of the profession and potentially leading to the adoption of outdated or irrelevant practices. The professional decision-making process for similar situations involves a commitment to continuous learning and a critical evaluation of information related to the field's history and definition. A PTR should consult authoritative sources, engage in peer supervision, and actively seek to understand the nuances of poetry therapy's evolution. When faced with defining or explaining poetry therapy, the professional should prioritize accuracy, historical context, and adherence to established professional guidelines, ensuring that their understanding and communication are both informed and ethically sound. Question 13. System analysis indicates that when a registered poetry therapist, PTR, works with a client who has selected a poem rich in evocative imagery and symbolism, and the client expresses a unique, personal association with a particular symbol that differs from common archetypal interpretations, what is the most ethically sound and therapeutically effective approach for the PTR to take? Option A. Acknowledge the client's personal associations, but subtly steer the conversation towards the literal meaning of the poem, suggesting that deeper symbolic interpretation is less relevant to the therapeutic process. Option B. Gently encourage the client to explore their personal associations with the imagery and symbolism, validating their unique perspective and using it as a foundation for further therapeutic dialogue. Option C. Prioritize established archetypal interpretations of the imagery and symbolism, guiding the client towards understanding these more universal meanings as the primary therapeutic focus. Option D. Directly offer the therapist's own interpretation of the imagery and symbolism, explaining how it aligns with established psychological theories and encouraging the client to adopt this perspective. The correct answer is B. Gently encourage the client to explore their personal associations with the imagery and symbolism, validating their unique perspective and using it as a foundation for further therapeutic dialogue. Explanation. This scenario presents a professional challenge in poetry therapy due to the inherent subjectivity of interpreting imagery and symbolism. A registered poetry therapist, PTR, must navigate this subjectivity while adhering to ethical guidelines that prioritize client well-being and the integrity of the therapeutic process. The challenge lies in distinguishing between a client's personal associations with imagery and symbolism and the potential for misinterpretation or the imposition of the therapist's own worldview, which could inadvertently pathologize or invalidate the client's experience. The correct approach, which involves a collaborative exploration of the client's personal associations with the imagery and symbolism, represents best professional practice. This aligns with the ethical principles of client-centered care, respect for autonomy, and the avoidance of harm. By actively inviting the client to share their unique meanings, the PTR fosters a safe space for self-discovery and validates the client's lived experience. This process respects the client's narrative and empowers them to derive their own therapeutic insights, which is a cornerstone of effective poetry therapy as outlined by professional standards that emphasize the client's agency in the therapeutic journey. An incorrect approach that focuses solely on established archetypal interpretations of imagery, without regard for the client's personal context, fails to uphold the ethical imperative of individualization in therapy. This can lead to misinterpretations that are irrelevant or even detrimental to the client's healing process, potentially causing distress or confusion. Such an approach risks imposing external frameworks onto the client's internal world, which is a violation of the principle of non-maleficence. Another incorrect approach, which dismisses the client's interpretations as irrelevant or secondary to the poetic text's literal meaning, is ethically unsound. This disregards the fundamental premise of poetry therapy, that the client's personal response to poetry is the primary source of therapeutic material. This approach undermines the client's voice and can create an environment of distrust, hindering the therapeutic alliance. It also fails to acknowledge the dynamic interplay between the text and the reader's psyche, a core tenet of therapeutic engagement with literature. A further incorrect approach, which involves the therapist unilaterally assigning symbolic meanings to the client's chosen poetry without client input, represents a significant ethical breach. This constitutes an imposition of the therapist's own interpretations, potentially leading to the client feeling misunderstood or pathologized. It bypasses the collaborative nature of poetry therapy and can lead to the therapist projecting their own biases or theoretical orientations onto the client's material, which is contrary to ethical guidelines that mandate objectivity and client-centeredness. The professional decision-making process for similar situations should involve a continuous cycle of assessment, intervention, and reflection, always prioritizing the client's experience. Therapists should begin by establishing a clear understanding of the client's goals and comfort level. When exploring imagery and symbolism, the PTR should adopt a stance of curious inquiry, posing open-ended questions that invite the client to share their personal associations. The therapist's role is to facilitate this exploration, offering gentle prompts and reflections, rather than dictating meaning. Regular supervision and consultation with peers can also provide valuable support in navigating complex interpretations and ensuring adherence to ethical standards. Question 14. Quality control measures reveal that a registered poetry therapist, PTR, has been analyzing client-created poetry by focusing on identifying recurring patterns of imagery and emotional tone, and then discussing these observations with the client to explore their personal significance and therapeutic implications. Which of the following approaches to analyzing client-created poetry is most aligned with the ethical framework and best practices for a registered poetry therapist? Option A. Analyzing the poetry for Freudian symbolism and discussing potential unconscious meanings with the client. Option B. Comparing the client's poetry to established literary canons to assess its artistic merit and originality. Option C. Utilizing a standardized diagnostic checklist to categorize linguistic anomalies and potential indicators of mental health conditions within the poetry. Option D. Focusing on recurring themes, emotional tone, and imagery present in the client's work, and collaboratively exploring their personal significance with the client. The correct answer is A. Analyzing the poetry for Freudian symbolism and discussing potential unconscious meanings with the client. Explanation. This scenario presents a professional challenge because it requires a registered poetry therapist, PTR, to balance the inherent subjectivity of interpreting client-created poetry with the need for objective, evidence-based therapeutic practice. The PTR must consider the client's expressed intent and emotional state, while also employing analytical methods that are recognized within the professional scope of practice. The challenge lies in avoiding overinterpretation or imposing personal biases, which could inadvertently pathologize the client's experience or lead to ineffective therapeutic interventions. Careful judgment is required to ensure that the analysis serves the client's therapeutic goals and upholds professional standards. The correct approach represents best professional practice because it prioritizes the client's narrative and lived experience as the primary lens for interpretation. By focusing on recurring themes, emotional tone, and imagery directly present in the client's work, the PTR remains grounded in the client's self-expression. This aligns with the ethical guidelines of the Registered Poetry Therapy (PTR) framework, which emphasizes client-centered care and the avoidance of imposing external frameworks without client consent or therapeutic justification. This method ensures that the analysis is a collaborative exploration, enhancing the client's self-awareness and agency, rather than a diagnostic pronouncement. An incorrect approach that focuses solely on identifying Freudian symbolism without client validation is professionally unacceptable. This fails to adhere to the PTR's ethical obligation to work within the client's frame of reference and can lead to misinterpretations that are not therapeutically relevant or even harmful. It also risks pathologizing the client's creative output by imposing a theoretical lens that may not resonate with their experience, potentially violating the principle of do no harm. Another incorrect approach, which involves comparing the client's poetry to established literary canons to assess its artistic merit, is also professionally unacceptable. This shifts the focus from therapeutic exploration to literary critique, which is outside the scope of poetry therapy and can undermine the client's confidence and the therapeutic relationship. The PTR's role is not to judge the artistic quality of the poetry, but to facilitate its therapeutic potential. This approach fails to recognize that the value of client-created poetry in therapy lies in its personal meaning and expressive function, not its aesthetic perfection. A third incorrect approach, which involves using a standardized diagnostic checklist to categorize the poetry based on perceived linguistic anomalies, is also professionally unacceptable. While some understanding of linguistic patterns can be relevant, a rigid, checklist-based approach can lead to oversimplification and misdiagnosis. It neglects the nuanced emotional and thematic content, as well as the individual context of the client's creation. This method risks reducing the client's complex inner world to a set of predefined categories, thereby diminishing the richness of the therapeutic process and potentially misapplying diagnostic labels without proper clinical assessment. The professional decision-making process for similar situations should involve a continuous cycle of assessment, intervention, and reflection, always prioritizing the client's well-being and therapeutic goals. Professionals should ask, Does this analytical approach serve the client's stated therapeutic goals? Is this approach grounded in the client's expressed experience? Am I imposing my own biases or external frameworks inappropriately? Does this approach align with the ethical guidelines and scope of practice for a registered poetry therapist? This critical self-reflection ensures that the analysis of client-created poetry remains a tool for empowerment and healing, rather than a source of misinterpretation or harm. Question 15. Research into the application of poetry in grief and loss counseling suggests that a client experiencing profound sadness following a significant bereavement might benefit most from which therapeutic action by a registered poetry therapist, PTR. Option A. Suggesting the client focus on writing about future aspirations and positive experiences to shift their emotional focus away from the current pain. Option B. Providing the client with a pre-written poem that encapsulates common themes of grief, encouraging them to adopt its sentiments as their own. Option C. Recommending that the client immediately engage in a support group for individuals experiencing similar losses, as peer support is often the most effective avenue for grief processing. Option D. Facilitating the client's exploration of their feelings and memories related to the loss through guided poetic expression, allowing the client to articulate their grief in their own words and imagery. The correct answer is D. Facilitating the client's exploration of their feelings and memories related to the loss through guided poetic expression, allowing the client to articulate their grief in their own words and imagery. Explanation. This scenario is professionally challenging because it requires a registered poetry therapist, PTR, to navigate the delicate and deeply personal landscape of grief and loss, while adhering strictly to the ethical guidelines and scope of practice defined by the credentialing body. The core challenge lies in balancing empathetic support with the professional boundaries and therapeutic interventions appropriate for a PTR, ensuring that the client's healing process is facilitated without overstepping into areas outside the PTR's expertise or the established regulatory framework. Correct approach represents best professional practice because it prioritizes the client's immediate emotional needs within the established therapeutic relationship, leveraging poetry as a primary tool for expression and processing of grief. This aligns with the PTR's core competency and the ethical mandate to provide services within their scope of practice. Specifically, it adheres to the principle of beneficence by offering a supportive and cathartic avenue for the client, and non-maleficence by avoiding interventions that could be misconstrued or lead to unintended harm. The focus on facilitating the client's own narrative through poetry directly supports the therapeutic goals of grief work, allowing for exploration, validation, and integration of loss. An incorrect approach that involves suggesting the client seek professional psychological counseling for their grief, without first attempting to address it within the poetry therapy framework, fails to fully utilize the PTR's specialized skills and may prematurely disengage the client from a potentially beneficial therapeutic modality. This could be seen as a failure to provide appropriate care within the PTR's scope, potentially leading to a delay in accessing the specific benefits poetry therapy can offer in grief processing. Another incorrect approach, such as encouraging the client to write about unrelated positive memories to distract from their grief, neglects the fundamental principle of grief work, which involves acknowledging and processing the loss. This approach could be interpreted as avoidance rather than integration, potentially hindering the client's long-term emotional healing and failing to meet the ethical obligation to facilitate genuine emotional processing. A further incorrect approach, such as offering unsolicited advice on how the client should feel or move on from their grief, is a significant ethical failure. This constitutes imposing personal beliefs and judgments, which is contrary to the PTR's role as a facilitator of the client's own journey. It violates the principle of client autonomy and can create a power imbalance, potentially causing distress and undermining the therapeutic alliance. The professional decision-making process for similar situations should involve a thorough assessment of the client's immediate needs and emotional state, followed by a consideration of how the PTR's specific skills and the modality of poetry therapy can best address those needs within ethical and regulatory boundaries. If the client's needs extend beyond the scope of poetry therapy, a responsible referral process, clearly communicated to the client, is essential. The PTR must always operate within their defined scope of practice, prioritizing client well-being and adhering to the ethical code of the registered poetry therapist credentialing body. Question 16. The audit findings indicate that a registered poetry therapist, PTR, is consistently using a pre-selected list of poems for all clients presenting with anxiety, regardless of the specific nature of their anxiety, their personal history, or their stated therapeutic goals. Which of the following approaches best reflects the PTR's responsibility to tailor sessions to individual needs? Option A. The PTR should ask clients to choose poems from a general anthology that they feel might be relevant to their anxiety, without further guidance or exploration of individual needs. Option B. The PTR should continue using the pre-selected list of poems for anxiety, as this ensures a consistent and evidence-based approach that has been found to be generally effective for many individuals experiencing anxiety. Option C. The PTR should focus on delivering a standardized curriculum of poetry therapy techniques for anxiety, assuming that the underlying mechanisms of anxiety are similar enough across individuals to warrant a uniform therapeutic intervention. Option D. The PTR should engage in a thorough initial assessment to understand the client's specific triggers, coping mechanisms, and desired outcomes for poetry therapy, and then collaboratively select poems and therapeutic techniques that directly address these individual factors, adapting the approach as the client progresses. The correct answer is D. The PTR should engage in a thorough initial assessment to understand the client's specific triggers, coping mechanisms, and desired outcomes for poetry therapy, and then collaboratively select poems and therapeutic techniques that directly address these individual factors, adapting the approach as the client progresses. Explanation. The audit findings indicate a need to review the registered poetry therapist's PTR approach to tailoring sessions, highlighting a potential gap in individualized care. This scenario is professionally challenging because effective poetry therapy hinges on a deep understanding of the client's unique needs, experiences, and therapeutic goals. A one-size-fits-all approach is not only ineffective, but also ethically problematic, potentially failing to meet the client's specific therapeutic objectives and contravening the core principles of person-centered care. The correct approach represents best professional practice because it prioritizes a thorough, ongoing assessment of the client's individual needs. This involves actively listening to the client's verbal and nonverbal cues, understanding their cultural background, life experiences, and stated goals for therapy. The PTR must then use this information to select appropriate poetry, therapeutic techniques, and pacing for each session. This aligns with the ethical guidelines for registered poetry therapists, which emphasize client autonomy, beneficence, and non-maleficence, ensuring that interventions are relevant, helpful, and do not cause harm. The ongoing nature of tailoring is crucial, as client needs can evolve throughout the therapeutic process. An incorrect approach that relies solely on the therapist's personal favorite poems or a predetermined curriculum without client input represents a significant ethical failure. This demonstrates a lack of client-centered practice and a failure to adhere to the principle of beneficence, as the chosen material may not resonate with the client or address their specific therapeutic needs. It also risks violating the client's autonomy by imposing the therapist's preferences rather than collaborating on the therapeutic journey. Another incorrect approach that focuses exclusively on the client's stated immediate desires without considering underlying therapeutic goals or potential contraindications for certain themes or poetic styles is also ethically problematic. While responsiveness is important, a PTR must also exercise professional judgment to guide the client towards deeper healing and growth, ensuring that the therapeutic process is safe and constructive. This approach could lead to superficial engagement or even re-traumatization if not carefully managed. Finally, an approach that uses generic poetry selections based on common themes, without any attempt to connect them to the individual client's narrative or therapeutic objectives, fails to meet the standard of individualized care. This demonstrates a lack of deep engagement with the client's unique situation and a missed opportunity to leverage the power of poetry for personalized healing. The professional decision-making process for similar situations should involve a continuous cycle of assessment, intervention, and evaluation. Professionals must actively solicit client feedback, observe client responses, and regularly reassess therapeutic goals. They should consult relevant ethical codes and professional guidelines, and when in doubt, seek supervision or peer consultation to ensure that their practice remains client-centered, effective, and ethically sound. Question 17. Market research demonstrates that clients often express a desire to share their poetry created during therapy sessions with friends or family, or even to submit it for publication. A registered poetry therapist, PTR, has been working with a client who has developed a deeply personal sonnet exploring themes of grief. The client has expressed a vague wish that others might find comfort in this someday. The PTR is considering how to respond to this sentiment, balancing the client's expressed desire with professional ethical obligations. Which of the following approaches best aligns with the ethical framework for a registered poetry therapist, PTR? Option A. Use the sonnet as an anonymized example in a presentation to other therapists about the therapeutic use of the sonnet form, without seeking further specific consent from the client. Option B. Share the sonnet with a general disclaimer that it was created in a therapeutic setting, believing that the client's sentiment implies a broad permission for sharing. Option C. Discuss with the client the specific implications of sharing their sonnet, including potential interpretations and the importance of explicit consent for any form of dissemination, and only proceed with sharing if the client provides clear, informed consent for a defined purpose and audience. Option D. Suggest to the client that they wait until the therapeutic relationship has concluded before considering any form of sharing, to avoid any potential transference issues. The correct answer is C. Discuss with the client the specific implications of sharing their sonnet, including potential interpretations and the importance of explicit consent for any form of dissemination, and only proceed with sharing if the client provides clear, informed consent for a defined purpose and audience. Explanation. This scenario presents a professional challenge for a registered poetry therapist, PTR, due to the ethical imperative to maintain client confidentiality and the potential for misinterpretation or misuse of poetic forms when shared outside of a therapeutic context. The core of the challenge lies in balancing the client's desire for creative expression and sharing with the PTR's responsibility to protect the client's privacy and well-being. Careful judgment is required to ensure that any sharing of client work aligns with ethical guidelines and respects the client's autonomy and vulnerability. The correct approach represents best professional practice because it prioritizes client consent and control over their own creative output. By seeking explicit, informed consent that details the specific form of sharing and the potential implications, the PTR upholds the ethical principle of client autonomy and respects the boundaries of the therapeutic relationship. This approach ensures that the client understands and agrees to the terms of sharing, mitigating risks of exploitation or unintended disclosure. It aligns with the ethical framework of the registered poetry therapist, PTR, which emphasizes client welfare and informed decision-making. An incorrect approach that involves sharing the client's sonnet without explicit consent, even if framed as an example of a specific poetic form, represents a significant regulatory and ethical failure. This breaches the fundamental principle of client confidentiality, a cornerstone of therapeutic practice. The PTR's professional duty is to protect sensitive client information, and sharing creative work, even for educational purposes, without explicit permission constitutes a violation. Furthermore, it disregards the client's right to control their own narrative and creative expression, potentially causing distress or harm. Another incorrect approach, which involves sharing the sonnet with a disclaimer about its therapeutic origin but without specific consent for this particular sharing, also fails ethically. While the disclaimer attempts to mitigate risk, it does not substitute for informed consent. The client has a right to know and approve how their work is used, regardless of disclaimers. This approach still infringes on client autonomy and confidentiality by making a unilateral decision about the use of their personal and creative output. The professional decision-making process for similar situations should involve a thorough assessment of the client's request, a clear understanding of the potential risks and benefits of any proposed action, and a commitment to obtaining explicit, informed consent. Professionals must always err on the side of caution when client confidentiality and autonomy are at stake. This involves open communication with the client, clearly outlining options and consequences, and ensuring that the client's wishes are paramount in all decisions regarding the sharing or use of their therapeutic work. The PTR's ethical code mandates a client-centered approach, prioritizing their well-being and privacy above all else. Question 18. Which approach would be most aligned with the registered poetry therapist, PTR, ethical framework when selecting a creative writing prompt for a client experiencing significant grief? Option A. Select a prompt that directly addresses the stages of grief, aiming to guide the client through a structured emotional processing experience. Option B. Offer a highly abstract and philosophical prompt to encourage deep introspection, regardless of the client's immediate emotional state. Option C. Provide a prompt that subtly suggests specific memories or emotions related to the deceased, intended to elicit a cathartic release. Option D. Collaboratively explore the client's current feelings and interests to co-create a prompt that feels relevant and safe for them to engage with. The correct answer is D. Collaboratively explore the client's current feelings and interests to co-create a prompt that feels relevant and safe for them to engage with. Explanation. This scenario is professionally challenging because it requires a registered poetry therapist, PTR, to balance the client's immediate emotional needs with the ethical imperative to foster genuine creative expression and avoid imposing personal biases or therapeutic agendas through prompt selection. The PTR must consider the client's stated goals, their current emotional state, and the potential for a prompt to either facilitate or hinder their therapeutic journey. Careful judgment is required to ensure the chosen prompt is a tool for exploration, not a directive. The correct approach represents best professional practice because it prioritizes client autonomy and the therapeutic alliance. By collaboratively exploring the client's interests and current experiences, the PTR ensures the prompt is relevant and engaging, thereby increasing the likelihood of authentic creative output. This aligns with the ethical guidelines of the Registered Poetry Therapy (PTR) framework, which emphasizes client-centered care and the use of poetry therapy as a means of self-discovery and healing, rather than a prescriptive intervention. The focus is on empowering the client to find their own voice and meaning through their writing. An incorrect approach that focuses solely on a prompt designed to elicit a specific emotional response, without considering the client's input or readiness, risks pathologizing the client or leading them down a predetermined therapeutic path. This fails to respect the client's agency and can undermine the therapeutic relationship, potentially violating ethical principles of non-maleficence and beneficence. Another incorrect approach that uses a highly abstract or complex prompt without adequate scaffolding or consideration of the client's current cognitive or emotional capacity could lead to frustration, disengagement, and a sense of failure, hindering the therapeutic process and contravening the PTR's responsibility to provide appropriate and effective interventions. A third incorrect approach that relies on a prompt that is overly directive or suggestive, subtly guiding the client's narrative, bypasses the core principle of poetry therapy as a vehicle for the client's own expression, and can be seen as an imposition of the therapist's agenda, which is ethically problematic. Professionals should employ a decision-making process that begins with understanding the client's stated goals and current emotional landscape. This involves active listening and open-ended questioning to gauge their comfort level and interests. The selection of prompts should then be a collaborative process, offering a range of options, or co-creating a prompt that resonates with the client's immediate needs and broader therapeutic objectives. Regular check-ins regarding the effectiveness and comfort level with the chosen exercises are crucial for ongoing adaptation and ethical practice. Question 19. The review process indicates that a registered poetry therapist, PTR, is working with a client who has chosen a poem that exhibits strong themes of individual emotional expression and a deep connection to the natural world. The client is exploring feelings of isolation and a search for personal meaning. The PTR has extensive knowledge of romanticism and its characteristic emphasis on these very themes. In facilitating the session, what approach best serves the client's therapeutic goals while ethically leveraging the PTR's expertise? Option A. Present a comprehensive lecture on the evolution of poetry from the Renaissance through modernism, highlighting the poem's place within this broader historical trajectory before returning to the client's personal experience. Option B. Focus solely on the client's immediate emotional response to the poem, avoiding any discussion of literary movements to prevent the session from becoming overly academic and potentially distancing. Option C. Categorize the poem definitively as a romantic work and use this classification to interpret the client's feelings, suggesting that their experience is a direct reflection of romantic ideals. Option D. Introduce the historical context of Romanticism, explaining how the poem aligns with its key tenets, and explore how these historical themes might resonate with the client's current feelings of isolation and search for meaning. The correct answer is D. Introduce the historical context of Romanticism, explaining how the poem aligns with its key tenets, and explore how these historical themes might resonate with the client's current feelings of isolation and search for meaning. Explanation. Scenario analysis. This scenario presents a professional challenge in applying historical literary movements to contemporary poetry therapy practice. The challenge lies in discerning when and how to integrate an understanding of movements like Romanticism or modernism into client work, without imposing an academic framework that might alienate or misinterpret the client's experience. A registered poetry therapist, PTR, must balance theoretical knowledge with the client's immediate therapeutic needs and personal narrative. The risk is either over-intellectualizing the poetry, thereby diminishing its therapeutic impact, or failing to leverage the rich historical context that can deepen understanding and connection. Correct approach analysis. The correct approach demonstrates an understanding that historical movements provide a lens, not a rigid mold, for interpreting poetry. A PTR's role is to facilitate the client's engagement with their chosen texts, drawing on knowledge of literary history to illuminate themes, stylistic choices, or emotional resonances that might otherwise be overlooked. This approach respects the client's subjective experience while enriching the therapeutic process by offering contextual insights that can foster self-awareness and deeper meaning-making. It aligns with ethical practice by prioritizing client-centered exploration and using historical knowledge as a supportive tool, not a prescriptive one. Incorrect approaches analysis. One incorrect approach fails to recognize the client's agency and the primary therapeutic goal. By prioritizing the demonstration of academic knowledge about a specific movement over the client's immediate emotional response or thematic exploration, it risks alienating the client and shifting the focus away from their therapeutic journey. This can be seen as a failure to adhere to client-centered ethical principles, potentially leading to a less effective therapeutic outcome. Another incorrect approach oversimplifies the application of historical movements, treating them as definitive categories that dictate the meaning or value of a poem. This can lead to misinterpretations and a dismissal of the client's unique connection to the text. Ethically, this approach can be problematic as it imposes an external judgment rather than facilitating the client's own discovery, potentially hindering their therapeutic progress. A third incorrect approach might dismiss the relevance of historical context altogether, viewing it as purely academic and irrelevant to the therapeutic process. While client experience is paramount, ignoring the historical and cultural forces that shape poetic expression can limit the depth of understanding and the potential for insight. This approach could be seen as a missed opportunity to enrich the therapeutic dialogue and could be considered a less comprehensive application of the PTR's skill set. Professional reasoning. When faced with integrating historical literary movements into poetry therapy, a PTR should first assess the client's engagement with the text and their stated therapeutic goals. The PTR should then consider how knowledge of movements like Romanticism, emphasizing emotion, nature, individualism, or modernism, exploring fragmentation, subjective experience, urban life, might offer relevant insights into the client's chosen poem or their expressed themes. The decision to introduce such context should be guided by its potential to enhance the client's self-understanding and therapeutic process, always prioritizing the client's experience and agency. The PTR must remain flexible, using historical knowledge as a tool for exploration rather than a definitive interpretation. Question 20. The analysis reveals that a registered poetry therapist, PTR, is working with a client who has expressed a strong preference for writing exclusively in sonnet form due to its perceived structure and elegance. The client believes this form is the only way they can effectively express their complex emotions. The PTR, while respecting the client's preference, recognizes that other poetic forms, such as free verse or haiku, might offer different avenues for emotional exploration and insight that could be beneficial for the client's therapeutic goals. What is the most ethically and professionally sound approach for the PTR in this situation? Option A. Immediately dismiss the client's preference for sonnets and direct them to focus solely on free verse, stating that the structure of sonnets is too restrictive for deep emotional processing. Option B. Insist on incorporating free verse into the sessions, explaining to the client that it is a more versatile form for therapeutic expression and that their rigid adherence to sonnets is limiting their progress. Option C. Gently explore the client's reasons for their strong preference for sonnets and discuss how other forms, like free verse or haiku, might offer complementary or alternative ways to express their emotions, allowing the client to make an informed choice about which forms to utilize. Option D. Agree to exclusively use sonnets for the duration of the therapy, even if the PTR believes it is not the most effective approach, to avoid any potential conflict or discomfort for the client. The correct answer is C. Gently explore the client's reasons for their strong preference for sonnets and discuss how other forms, like free verse or haiku, might offer complementary or alternative ways to express their emotions, allowing the client to make an informed choice about which forms to utilize. Explanation. The analysis reveals a scenario where a registered poetry therapist, PTR, is faced with a client who expresses a strong preference for a specific poetic form, potentially limiting the therapeutic exploration. This situation is professionally challenging because it requires balancing the client's expressed desires with the PTR's professional judgment regarding the most effective therapeutic modalities. The PTR must consider the client's autonomy while also ensuring the therapeutic process is not inadvertently constrained by a rigid adherence to a single form, especially if that form might not be the most conducive to addressing the client's stated goals. Careful judgment is required to navigate this delicate balance. The correct approach represents best professional practice because it prioritizes a collaborative and client-centered therapeutic relationship, grounded in the ethical principles of beneficence and non-maleficence. By exploring the client's reasons for preferring a specific form and gently introducing other forms as potential avenues for deeper exploration or different types of expression, the PTR demonstrates respect for the client's agency while also fulfilling their ethical obligation to provide comprehensive and effective therapeutic support. This approach aligns with the core tenets of therapeutic practice, which emphasize adaptability and responsiveness to individual client needs. An incorrect approach that rigidly adheres to the client's initial preference without exploration fails to uphold the PTR's professional responsibility to guide the therapeutic process effectively. Risks limiting the client's potential for growth and insight by not exploring alternative forms that might unlock different aspects of their experience. This could be seen as a failure of beneficence, as the PTR is not actively seeking the most beneficial path for the client. Another incorrect approach, that of dismissing the client's preference outright and imposing a different form, represents a failure of respect for client autonomy and can damage the therapeutic alliance. This approach prioritizes the therapist's agenda over the client's expressed needs and preferences, potentially leading to client disengagement and a breakdown in trust. It violates the principle of respecting the client's right to self-determination. The professional decision-making process for similar situations involves a systematic approach. First, actively listen to and acknowledge the client's stated preference and explore the underlying reasons and motivations behind it. Second, assess whether the preferred form is therapeutically viable and aligned with the client's goals. Third, if there are potential benefits to exploring other forms, gently introduce them as options, explaining their potential advantages in relation to the client's specific therapeutic objectives. Fourth, maintain open communication and allow the client to make informed choices within the therapeutic framework. This process ensures that the PTR remains both ethically grounded and therapeutically effective.